everyone, and welcome to the Doctor Show. This is again Dr. Zahra, and I'm here to talk with you about medicine, about diseases, about things you always wonder about. Today we're going to talk about something we all have. At least we have it once every now and then, which is headaches. We all have headaches. We all complain of headaches. We all want to know what types of headaches we have. We all want to know why do we have them. Headache is one of the commonest health issues that all people have, and it actually is caused by so many things like stress, anxiety, depression, or an actual disease that causes me the headache. What is the actual disease? In order to know the diseases, we have to categorize the headache. It could be primary headache and it could be a secondary headache. Primary headache, it means the headache is the disease itself. My disease is a type of a headache. Or secondary, it means that I have something else in my body that causes the headache. Something else like my toothache. It actually refers to my head and I'll feel the headache. Or if I have sinusitis and my sinuses hurt. If I have an ear pain and if I have anything else that causes me the headache. So it's called a secondary. In the secondary part that we will not talk about today, because obviously we need to treat the causing factor. So that's what we do for a secondary. We need to go to a doctor and make sure we treat the actual cause. But for the primary headache, we have so many types of headache, and today we're only going to mention a few of them. The first one we're going to talk about is something called a tension headache. What is a tension headache? It's the number one commonest cause of primary headaches worldwide. It means it happens because of stress, anxiety, depression, and all of these stresses we have in our daily routines. It causes a headache. It's called tension headache. It actually happens for as long as you have the cause of the stress, and then it happens a whole band around your head. It starts in the middle of the day and it gets very, very worse at the end of the day. And a lot of pressure on your sides of your face, a lot of pressure on the back of your neck, and all of that. These headaches could be episodic. It happens once every long while, or it could be chronic. I'm going to get off topic a little bit and tell you what the word chronic means. The word chronic means is a disease that you have that will take a long time. Like what? Like diabetes, like hypertension, like all of these diseases. They're called chronic diseases. You know, when we talk about COVID-19 and we say some people with chronic diseases are more likely to have it, we all hear this word chronic disease all the time. Do we know what does it mean? I think now we know that it's a long-term disease. Let's get back to our headache topic. So the tension headache could be actually chronic, which means could take a long time of your life, and you have to actually go to a doctor and make sure you know the right treatment for it. The second type of the headache we're going to talk about is something called a migraine. Actually, we will talk a little bit more about this because it's a bit more complicated, and I am personally a victim of this disease. It's very, very unfortunate to have it, and it's the second commonest cause of primary headaches worldwide. What is a migraine? A migraine is a type of headache that happens on one side of your head. Could be any side, and they could switch once in a while. It causes something called a throbbing pain or pulsating pain. Pulsating means just like the pulse on your hand. It comes and goes. It comes and it goes. This pulsating pain behind your eye sometimes, or your forehead, it actually could stay from a few hours up to 3 days continuous. So it's very, very bad. And not just that, it actually is a life limiting. It means it's very, very unfortunate that it will make you stop everything you're doing and just sit in a quiet room with dim lights and no noise. Why? Because a lot of things can trigger the migraine, can make it happen more often, can make it happen more severe. Like what? Like excessive lights, like a lot of bad noises, like extreme temperature, too hot or too cold when they actually hit your forehead or your face or your body, or some certain food triggers like types of cheese, chocolates, tomatoes, caffeine, and caffeine could actually help and harm migraine at the same time. All these things are triggers. So the person who have the migraine, they should know their own triggers. It differs from one person to another. And when it starts, it could start as something called an aura. An aura means that you feel lightheadedness, you have nausea, you might vomit, you might actually feel very, very bad, and you have a lot of visual disturbance. And it could happen without any of these. You just out of nowhere start having the one-sided headache. So migraines are very, very, very unfortunate, and we have to go to a doctor, make sure to know the right treatment, and most importantly, avoid all these triggers that could cause the migraine. The third type of headache we're going to talk about, it's something very weird. It actually is called medication overuse headache or a rebound headache. What does that mean? Rebound headache is when you have any reason that you might have other headaches and you take so much painkillers. Like every day you take multiple ones. So all these painkillers, they could cause you the headache. It might sound weird, but it actually does make a lot of sense, because if you use a lot of things, the overuse of anything is wrong. Overuse of anything could cause you damage of any certain thing. So imagine you overuse a lot of medications that you actually usually use could cause you this type of headache. So what do? You stop them immediately and you go to a doctor, and he or she will tell you the right way to use them. So even if you have a certain type of headache like tension headache or migraine, actually the Migraine Trust, which is an organization in the UK, they said that the people with migraine usually have the rebound headache because they always use a lot of medications. So if you are a person with migraine, always try to avoid overusing the medications. And if you're a person who usually takes painkillers, make sure you take the normal amount of them. Make sure you ask your doctor, how many pills am I allowed to take every day? You're not allowed to just use whatever you want unless you are a doctor and you know what you're doing. So what do you feel when you have a rebound headache? You usually feel neck pain, you usually have trouble sleeping, you usually have you know that you have the predisposing factor, which is you take a lot of medication. When you doubt it, make sure you go to a doctor, and the doctor will help you actually stop your medications. But please, all in all, do not use a lot of medications, because it is very bad unless the doctor prescribes you to do so. The last headache we're going to talk about today is something called cluster headache. This type of headache is actually a little bit weirder. It comes on a phase of your life, could be a few hours to a few weeks, and then stops completely. Like you have a whole period between the two headaches, you're symptom free, you forget that it ever existed, and then it gets back again. This period in between could be a few months up to a few years, you have no headache at all. And then when it comes back, it stays for a little while and disappears. It comes in clusters, so it's called a cluster headache. What are the symptoms of it? The symptoms of it are a bit different than the other types of headache. They actually make you have redness in the eye, your eye will tear up, your nose will get runny or obstructed. It's basically make you all red down here, all teary eyes and all pain around your eye. What do? You actually make sure to take the right painkillers, make sure to protect yourself, make sure to know what is the disease so you expect it. If you know that it could come for a few while and then it will disappear, you know what's going to happen. You have to know your disease before you know the treatment. You have to diagnose yourself. You have to know what do you have. And when you know the disease you have, let's say you have migraine or tension or all of that, when you know the disease, you would expect what's going to happen. You would know what's the treatment, and you would know what could cause it to happen. So all in all, do you think all the headaches we have are cluster or tension or migraine? Of course not. We do a lot of things that could exacerbate our headache, that could make it much, much, much worse. So now I'm going to talk about a lot of things that could make me have a headache, and I don't even know that they do. Number one, what do? I stare at my phone the whole time, and it's actually such a close way between me and my phone. Do you think that's healthy? Absolutely not. It actually causes your eye muscle to strain, to hurt, and it literally tells you stop. That's why it hurts. It tells you to stop. So what do when even if you have to use the phone or the computer, or you are reading a book for so long, if you have to use it, we do the 20-20 method. Every 20 minutes, look away for 20 seconds, like at least 20 feet apart, 20 feet distance, for 20 seconds, and then come back. It makes your eye look something far and then close. So it makes you have accommodation to the far and the near, and make your eye muscle rest a little bit between you and looking at your phone. What else could cause you a headache? Lack of caffeine. If you are addicted to caffeine, just like I am, which is very, very bad as well, when you stop the caffeine for a long while, just like the mornings in the fasted month of Ramadan, just like any day when you did not have coffee in your house, you might start having headaches. Headaches is the lack of something your brain is used to every single day. So what do you do to avoid that from happening? You have to suck it up a little bit and wait and try to stop it for a little while. Or you can decrease it one step at a time. If you drink 2 cups every day, make sure after a few weeks it's 1 cup or half a cup or a little bit, some few sips just to get you the rush of the caffeine and that's it. Or just switch to decaf. But make sure not to get addicted to a lot of caffeine because it's actually not good. Number 3, the cause of us having more headaches is you not sleeping well. The way you sleep at night is very, very, very necessary to know how to do it comfortably. The average person sleeps 1/3 of their whole lifetime, just spends it sleeping. So guys, make sure to do it while you're comfortable. Make sure you do it right because you're gonna do it every single day. So when you sleep on your back, it's not a problem because your back and your head are almost at the same level. But when you sleep on your side, this is where the problem comes. It has to be on the same level. So make sure your mattress is comfortable, make sure your pillow is comfortable, make sure all your back and your neck are on the straight line. That's why when you're comfortable, so you wouldn't have a headache when you wake up. What else that could cause you a lot of headache? And I'm very, very sad to tell you it's cheese. I'm very sad to tell you that because actually cheese is very yummy and good. But some certain types of cheese have a certain substance that could cause you a lot of headache. If you have headaches after cheese, you can, and I'm sorry to tell you that, you can avoid it sometimes to make sure you not have a headache. What else could cause you a headache? Not having a healthy life in general could cause you a headache, so you have to make sure that you exercise a lot. And by the way, a lot of things that they cause you headache when you don't know, like what? Like the prescription glasses. When people wear glasses because of any error in their eyesight, if you wearing a glasses very, very newly, like you just discovered that you have an issue and you need to wear glasses, your eye will hurt because it's trying to get used to the glasses. It's trying to accommodate to the glasses, so it could hurt. Or if you've been wearing it for a long while, it could hurt because you need a new one. You need to change the prescription. You need to go and check your eye doctor and to make sure you actually change your prescription. The last thing I'm gonna talk about is something we always do. Your headphones, your hats, your cap, your headbands, anything that you actually tie your head with is very, very bad to be tied. It's called a compression headache. Usually when it hurts when you're wearing a tight cap for a really long day and it hurts, you take it off, you feel much, much better because you've been compressing all over the head for so long, and that's quite wrong, and you know that it's wrong and you should not do it more often, especially even the headphones because they put a lot of pressure on your ear, not just your head. So that's very bad. So I keep on talking about causes of the headache, types of the headache, and all of that. Is it any useful without knowing the treatment of the headache? Not really. So now we're gonna talk about the treatment of the headache. So usually if you have a slight headache that doesn't bother you that much, you can take an over-the-counter medication, a painkiller like anything, paracetamol, aspirin, any non-steroidal anti-inflammatory drugs that actually do not hurt once in a while if you know that there's a doctor that prescribed it before. The word over the counter, it means that you prescribe it for yourself. You don't have to necessarily go to a doctor every time you have a headache. But if you feel that your headache is abnormal, it happens a lot, it happens way more often than before, the pattern of the headache is similar, you need to, if one of your headaches is one of the headaches I mentioned above, I mentioned before today, you actually have to go to a doctor. And you should not prescribe yourself a strong painkiller unless a doctor says so. So make sure not to take over medication just like I said before. What else is the treatment for the headaches? When I told you there are triggers for the headache, like tension, stress, anxiety, migraine, they have a lot of light and weather, extreme weathers and all of that, you can easily avoid all of that. You have a brain to think what could cause it and what could actually make it not happen. So you actually avoid all these triggers to protect you at least from 1 or 2 times that are unnecessary to ruin your day with a headache. And sometimes you can actually do some home remedies. What does a home remedy do? When you have extreme weather, like it's too hot outside or it's too cold, you can have cold compressants or hot compressants on your head, but please make sure to not put ice directly to your head. That's actually not healthy. What else you can do? You can actually eat healthy. Eating healthy and exercising can boost your health in general and can make you avoid all these headaches. If you sleep very, very well, could actually avoid headaches. And again, if you sleep in the right position and if you drink a lot of water. Lack of water or dehydration is one of the commonest causes of headaches, of the normal everyday headache, and we don't even know. The first thing you do when you have a headache, you remember, did I drink enough water today? And you might actually feel like you didn't. So make sure to have your enough water intake every day. Again, we must have up to 3 liters of a day of water every single day. And if you feel like you might have a more dangerous headache, just like what I mentioned, like cluster headache or tension or migraine, and all of that, please make sure to go to your doctor to make sure you have the right medication to your disease. If you just prescribe yourself any medication, they might not help. On the contrary, they might just actually harm and do the rebound headache, just like we talked about. That's it for today. We talked about headaches. I hope you all never have a headache. And thank you for watching. And if you have any questions, always know that I'm here to answer. Have a really good day, and I'll see you next Tuesday. Bye-bye.